welcome everybody for coming, and thank you for coming out to the Sussex Defend the NHS Kemptown debate, and it's great to see so many people here.
And where's Simon Kirby?
Well, Simon Kirby.
What does that say?
It says, Simon Kirby, self-styled champion of the NHS, invited 2 months ago. In fact, Simon was asked to attend the meeting as the local MP in January, early January, and has declined to attend, despite quite a lot of encouragement. And encouragement...
Change the date?
Thank you, Nancy. And we changed the date as well to try and accommodate him. So we're very disappointed. Before I open it up to the panel, I'm going to ask a member of Sussex Defend the NHS just to give a little outline of what the organisation is, because it's Sussex Defend the NHS who are hosting the evening.
It's brilliant to see so many people. Thanks so much for coming. Sussex Defend the NHS has been going for about 3 years, and we've got nearly 2,000 people on our mailing list. We have a lot of friends on Facebook, Twitter. The word is really starting to spread, and this is a fantastic turnout. It's wonderful. For those who don't know our activities, we've done loads of things. We launched the Politicians' Pledge, the very successful Politicians' Pledge, at the end of last year, and we've had 60 politicians sign up to defend the NHS and to make a commitment to defending it, which is wonderful. We organised the Making a Drama Out of a Crisis event in January, which some of you may have come to, and we actually have DVDs of the event at the back if anyone would like to buy one. And also we organised the exhibition, NHS exhibition last summer, which was attended by about 300 people. But I think the important thing to say is that we really, really want to ensure this momentum we've got going is fantastic, but we really want to make sure that it continues after the election. Now, I realise there's probably going to be quite a lot of depressed people around after the election, but it's even more important that we keep the struggle going. So please think about that, and we will be letting everyone who's on our contact list know. We already have plans for major events in May and June. So please sign our contact list, keep informed, and get involved. Thanks a lot.
The NHS has a huge budget of £120 billion. It also has the largest workforce in the United Kingdom, 1.5 million people, and it treats 1 million people every 36 hours. So it's an incredibly important service. It's also one of the best health services in the world. The Commonwealth Foundation report compared health systems in 11 advanced economies and found that the NHS came out top overall and in most of the individual categories. And that was amazing because the NHS has the second lowest spending per head of the population of all those healthcare systems which were studied in that system, as opposed to the American one, which is one of the most expensive and came bottom of that study. So that's very important, and the NHS is undoubtedly the most cherished institution in this country. 85% of people want there to be no cuts or privatisation in the NHS. Very few of them want to introduce charging. So no doubt everybody on this platform will promise to protect it. Even Simon Kirby, had he turned up, would have said he would protect the NHS. But the brutal truth is that the NHS has never been more under threat than it is today. There is a real and creeping privatisation of the NHS taking place. The people who want to privatise it know that if they came out openly and said what they wanted to do, there would be uproar and massive opposition. So they do it slowly, one step at a time, introducing hundreds of small market mechanisms into the NHS and lots of service cuts, often under the name of service efficiencies. The NHS is increasingly being reduced to little more than a logo. This has been going on since the Thatcher government. After all, they introduced the purchaser-provider split. They contracted out support services. And I would remind Paul just what a disaster contracting out cleaning services has been in the NHS. The Conservatives introduced the Private Finance Initiative, which is probably the most useless hire purchase scheme ever invented. But sadly, the last Labour government deepened and extended those market mechanisms into the NHS. It allowed trusts to become independent foundation trusts. It initiated the Independent Sector Treatment Centres, ISTCs, which now have a budget of £5 billion off the NHS. And 3/4 of the hospitals built under Labour were under PFI, and they're all now saddled with massive debts. By 2010, the extent of private sector involvement in the NHS was up to nearly 5%. Now, of course, the coalition government, which includes, Paul, the Liberal Democrats, passed the appalling Health and Social Care Act 2012, which took away the responsibility of the Secretary of State to even provide a national health service. It also forced all trusts to become foundation trusts and enables them to generate up to 49% of their money from the private sector. And private health firms already are pocketing £18 million a day from the NHS. And there are huge cuts going on. We now have less nurses per head of the population. 4,000 senior nurses posts have gone. 600 ambulance stations are earmarked for closure. 50 out of 230 NHS walk-in centres have gone. 68 A&E units have been downgraded or closed. More than 170 GP services are now run by corporations. And that's not to mention closing down the NHS Direct and replacing it with a ridiculous telephone system. And of course, we all know about the crisis in A&E that's going on at the moment. And that is caused in no small part by the huge cuts from this coalition government to local government and to the care services within local government. And as in turn, the care budgets have been slashed so deeply that many people can't leave hospital as there's no care plan in place to allow them to return home. So when you listen to the other parties on this platform tonight, judge them by their actions, not just their words. Judge the Liberal Democrats on the coalition government's record on the NHS. Judge Labour by what it did 13 years in government to the NHS. The Green Party is absolutely opposed to cuts and privatisation. It's committed with no qualifications to the idea of a publicly funded free National Health Service and free social care for the over 65s, which is funded by general taxation. You know you can really trust the Green Party to stand up for the NHS. Thank you.
The first thing I need to say is, of course, the NHS is marvellous. It is the best national health system in the world. And one recent analysis that I saw, it came top in 7 out of 8 criteria. Actually, this has not always been the case, and in the British Social Attitude Survey of 1990 found that 47% of the British public were either very or quite dissatisfied with the NHS in 1990. And I'd like to pay tribute to Labour, who over 10 years did invest considerably in improving the NHS. Sadly, a lot of that, it was a promise by Tony Blair to get the spending up to the average European level of spending. Sadly, a lot of the investment in infrastructure was undertaken via disastrous PFI contracts that have cost the service dear ever since. And that is one form of private sector involvement in the NHS that we would all like to see the back of. Actually, I stood, I'm sad to admit, in the general election in 1997 in Worcester City, and I was the only candidate who opposed a PFI contract to build a new hospital in the city. We were told there is no alternative. That was a phrase that was quite popular at the time. I was branded as putting the new hospital at risk by raising such a technical matter as to how the hospital was to be funded. And that's when I learned that politicians will accept any amount of skullduggery in order to get new facilities for their area. So apart from the dreaded PFI, there are 4 other ways in which the private sector are involved in the NHS. There's competitive tendering for hospital services like cleaning and catering, etc. And we, Liberal Democrats, support this idea in principle because I believe that competition leads to more transparency and to help reduce costs. I'm told that the private sector only involves 6% of such services, although other people offer a different figure. I've been told I've only got a minute. That must be the fastest 4 minutes. So I'm going to skip the other methods whereby the private sector gets involved in the NHS, but just to say that they will probably come up. I don't know about. They will probably come up in the questions later, so I'll bring them up then. Let me end on the positive. I heard an interviewer ask one of our MPs on the radio. He said, "What are the Liberal Democrats for?" Well, I want to say what we're for. And one thing we are unfailingly for is the NHS, free at the point of use. We are for maintaining the NHS, widely acknowledged to be the best health service in the world. And we are for finding the £8 billion a year that is needed to keep the NHS on an even keel. Thank you.
That's lovely. Thank you.
Okay, my name is Nancy Platts and I'm standing to be the Labour MP for Brighton, Kemptown and Peacehaven. And I'm very proud to be supported by 8 trade unions to stand. And I'd like to thank Sussex Defend the NHS for inviting me along this evening and all of you for coming. And I want to start by paying tribute to all of the staff that work in the NHS and for the incredible job they do to deliver a world-class health service. My working life has been devoted to campaigning for social justice. I've worked in a number of healthcare charities, including Breakthrough Breast Cancer, Diabetes UK and Asthma UK, and I will fight for good healthcare, free at the point of use, and I will fight for NHS services to be returned to the public sector where they belong. And I want to be absolutely clear where I stand. I oppose any privatisation to the NHS. Now, the NHS was one of Labour's finest achievements, and we must protect it at all costs. And this Tory Liberal Democrat government has unleashed a tidal wave of market forces into the NHS with their Health and Social Care Act. They've wasted £3 billion on a chaotic reorganisation of our NHS that was not needed. And the Conservative Member of Parliament, Simon Kirby, must be held accountable for his actions and the damage that has been inflicted on our NHS locally, because he voted for the measures that are making it happen. He voted for the Health and Social Care Act that has allowed a free-for-all within our NHS. That must be stopped, but that was also pushed through by the Liberal Democrat MPs. And what are the result of the changes? 6,000 fewer nurses since 2010. A&E times are rising and we've got competition instead of collaboration. Labour will repeal the Health and Social Care Act that puts private profits before patients. We want NHS professionals to be able to focus on patient care and not competition law. We're going to create a £2.5 billion Time to Care fund to save and transform our NHS. And that includes 20,000 more nurses, 5,000 more care workers, 3,000 more midwives and 8,000 more GPs. And by appointing these extra staff, our doctors and nurses will have the time they need to care for patients properly, as well as transforming the service in our communities. Now, I've worked in those healthcare charities with people who've got long-term medical conditions, and what they need is fast access to good quality care. And that's why Labour's going to introduce a guaranteed GP appointment within 48 hours, a maximum 1 week wait for cancer tests, and we'll create a new cancer treatment fund to improve access to drugs, radiotherapy and surgery. And whatever the criticism from the other political parties, it must be remembered that in 13 years of the Labour government, we also reduced waiting times from 18 months down to 18 weeks. We stopped people from being disabled because they were waiting for hip replacement operations for so long, and we got that fixed. And it may be that some people don't like the way that we did that, but we did ensure that people got the care they needed when they needed it. We're going to improve access to mental health support too. We're going to make sure that people have got access to talking therapies. I've worked in a women's charity where women have spent 10 years on the same medication without that being reviewed or without being offered alternatives, and that's something that's got to change. We will end the scandal of the 15-minute time that people get with their care workers, and we'll scrap the 0 hours contracts that apply to care workers. People need to be treated with dignity and with respect and not shunted along like they're on a conveyor belt with barely enough time for help with personal care. So we've seen the impact of the Health and Social Care Act on patients, and I know from talking to staff about the failures of the government reorganisation, they're showing up in the corridors, they're showing up in A&E, and people are leaving, and care is worsening because there's no flow through the hospital, and the government has spent the last 3 years privatising and reorganising the NHS rather than trying to integrate social and medical care. And this government have been happy to see patients lying for hours in corridors in A&E, not waiting to be seen but waiting for a bed. And it's not just happening here in Sussex, it's happening throughout the country. Now, Labour is going to join up services. We're going to join up mental health, physical health and social care so that older people can go home more quickly. They can get support in their own homes and we'll be able to free up beds more quickly. Now, the NHS was one of Labour's proudest achievements. We all love it, we all value it, and we've got to fight to protect it. In 27 days' time, we have the chance to do just that. And there's a clear choice in this election, and it's between a Labour and a Tory government. It's between more of the same or a Labour government who are going to increase staff numbers and scrap David Cameron's privatisation plans. And this is the only chance we will have for another 5 years. And I don't think the NHS will survive another 5 years on the Tories. It's time to put people before profit. The NHS is there from the start of our lives to the very end, and now we've got the chance to save it. Thank you.
Good evening all, my name's John Donovan. I work at the county. I've worked there 22 years approximately in the Sterile Services Department. I'm a GB rep and I'm also part of Defend the NHS. The NHS is dying. Putting it bluntly, it's nearly dead already. For those of us that work inside it, we are finding that we're having to work longer hours, under more stress, under more strain, with more paperwork and less actual patient care. The Social Care of 2012 Act gave trusts. And R1 is not a foundation trust yet, but I would point out that Mr. Lansley, who was before Mr. Hunt, wanted every trust to be a foundation trust by the beginning of 2016. That's next January. And bearing in mind Stafford was a foundation trust, they were so bent on actually making profit and using money, it was at the end of people's expenses of their lives, literally. And that is what we've got to make sure doesn't happen now. This new part of the hospital should be for everybody. It's public money, but under the 2012 Social Care Act, 49% of all foundation trusts have to get their revenue from private streams. So it's more conceivable to think that that new building will be paid by public money, but some of it will be used for private patients only. That is simply wrong. I'm not going to say who you should vote for. What I would say is, vote for whoever you think is going to defend your NHS, because once it's gone, it's gone. And I just reiterate what, in fact, some of the other people said on the panel tonight, and that is, it is the best in the world. The system that they want to try to push us through is the American system, which is actually number 11 in the world. This is where basically, as Mr. Barmer did when he tried to bring in the American NHS health service, you go to the hospital, if you have a heart attack, the first thing they check is not whether you're breathing or not, it's whether you've got a credit card in your pocket. And that's what it comes down to. There's already been talk and there's already been mentioned about possible £10 to see your doctor. £10 to go to your first doctor's visit. No, we own it. We've already paid for it. Why should we pay for it again? It's your NHS. You earned it. You paid for it. And let us not have the situation, although it was a totally moving speech, which the old boy said at the Labour Party conference about being that his past is going to be our future. Because I'm, for one, I'm going to damn well make sure that it doesn't happen up that way.
Thank you very much for inviting me to speak. Can you hear me with that microphone? Yeah. It's an honour to be able to speak at this event, but it's a shame that we're not having the debate we need. Because although everyone says they believe in the NHS, words mean nothing. It is the reality of the policies which need exploring and debating. And this is something which we can't have if we've not got all the candidates here. So why am I speaking? I'm not standing for election like the others, or asking for your vote, but I do care. I care passionately about what is happening to the NHS, and I'm worried about its future. So worried, in fact, that I escalated my concerns to David Cameron. He didn't get back to me, but When someone comes in unwell, they know in the NHS they will get the best possible care, regardless of whether they're a dustman or a lord, and that is something we should be proud to have. They don't have to worry about the cost of their illness or whether our insurance company will pay up. We must not lose sight of how fortunate we are to have this NHS, and we must not take it for granted. But just being free at the point of need is not what makes the NHS special. It is because of the ethos of the NHS. It is run with patients being central and key to everything we do. Hospitals and GPs and community care cooperating and not competing. The NHS is not just a kite mark which companies can put above their signage. It is an ethos. Because healthcare flourishes when you take the profits out of it. But when you start paying for individual procedure, then you change the mentality of the people who work in it. Also, if you have an NHS which isn't worried about profit, it becomes so much more efficient to run. You don't have to worry about the cost of accountants and lawyers looking at contract law. You can invest that money in clinicians and patient care. And the NHS is good because at the moment, though we're losing it, we are like that. We spend per person a lot less than most of all major economies. But as everyone's alluding to the Commonwealth study, which looks at health outcomes, and despite the amount we spend, which is way below average, we perform top of the world. And that is because the NHS, the way it's funded, the way it works, the ethos of it, is unique around the world, and we should protect and cherish it. Especially now, because now its very future is under threat. And the threat is the NHS bill, which has recently come to pass. Now, I don't want you to think we don't have problems. We do. I see them every day. The problems of the NHS are shown up in the coroner's emergency departments throughout the country. And I know we need to reform the NHS as well. We certainly do. Especially with the increasing elderly population, we have to have different ways of working. And also, it's been shown that centralising care can improve outcomes. It's been known for a while. Someone said, I'd rather be kept alive in the efficient, if cold, altruism of a large hospital than expire in a gush of warm sympathy in a small one. That was Nye Bevan. So reforming the NHS is not against the principles of the NHS at all. But this reform needs to be done correctly. It needs to be done by putting the patients at the centre of everything we do, and not reforms so the private corporations can make profit. But sadly, that is not what's happening in the last 5 years. Reforms have been implemented which have put the very future of the NHS and its existence at risk. If we carry on the same trajectory, we could see in 5 years' time a very, very different NHS to what we're used to. There's been underfunding for the NHS. OK, it's gone up by 0.1% in the last 5 years. But the underfunding has really come in social care, where 40% cuts, up to 40% cuts, have made it so difficult to get our patients discharged from hospital. And that is the reason why there is bed blocking. That is the reason why there's problems in NHS. Because NHS and social care is all one pot, really. But I could cope with this lack of money. I could cope with this lack of expenditure in the NHS. Because the NHS was born in a time of austerity, and it could still thrive in a time of austerity. The problem I have is the impact of the NHS and social care in 2012, which has only come into existence the last year. Billions have been wasted on forcing competition for ideological reasons into the NHS. Billions wasted on management reorganisations, which no one really understands. Billions spent on contract lawyers. Billions wasted on a mantra and thought that competition and profit is more important than cooperation and patience. I don't know if it's a malicious, deliberate damage to the NHS or an accidental failure. But what I do know is that no one really agrees with what's happened. Even the Tories were embarrassed. Stephen Dorrell, the last before Andrew Lansley, Health Secretary, said it was the biggest failure of this Parliament. But I don't blame the Tories, because their ethos really is about privatisation and bringing the private sector into the NHS. I do, though, blame the Liberal Democrats. Just have 1 minute, please. Does anybody mind if I have 1 minute? Okay.
Everybody wanted an extra minute.
Oh, okay. Just 30 seconds.
Just keep going.
Okay. Sorry. But the Liberal Democrats voted for it when that wasn't in their ethos. Let's look at what's happened. 50% of new contracts since the NHS bill have gone to the private sector. And look at Worthing, a simple decision to privatise orthopaedics nearly damaged the hospital. But luckily, people like you in the NHS, Sussex Defend the NHS, stopped that by getting the public to realise what was happening. Everywhere you see the Private ethos does not work in a healthcare setting, but they're carrying on with this mantra. And what they want to do is us to blame ourselves, fight amongst ourselves, hospitals to blame GPs, GPs to blame hospitals, and even the patients. But actually, let's blame the people who've damaged the NHS, the politicians. The politicians who've damaged the NHS the last 5 years. And let's really try and think, when you come to vote, I'm not going to tell you who to vote for, when you come to vote, do you want to vote for a party which supports this bill which has damaged the NHS so much? Or do you want to use your vote, tactically or however you want to do it, to a party or parties which defend the NHS and want to stop this privatisation happening? Because in 5 years' time, you may come to regret what's happened in this election if we see the NHS not as it is now. Thank you very much.
I'd like to ask a question about mental health, although I acknowledge, Nancy, what you've already said on the subject. I believe that everybody in this room knows that mental health services in this constituency have been cut to the bone. Working as a welfare rights advisor, I see the disastrous outcome of people who cannot get a referral, who cannot get a mental community health worker. They don't get the support that they need, and they end up in A&E, of course, where they get blamed for being a nuisance. Most unfairly, in my view, because they are the result of neglect. So, candidates, if you were elected in this constituency, how would mental health services be improved, please?
The question I want to ask is this, and it's about the so-called reforms. They're not reforms. It's pure destruction. It's destruction of the National Health Service. And so the question I want to ask is, will each of the parties represented here, I know the Tory answer, and I'm glad UKIP's not here, the question I want to ask is, not only will you stop privatisation, but will you reverse it? Will you get rid of the internal competitive market? Will you, in the words of this Tusk poster, which is upside down, now it's the right way up, will we say public health, not private wealth? Reverse the privatisations, not just stop them.
At the last meeting we had at the Friends Meeting House, there was a resume given out of the National Health Service Reinstatement Bill, which I thought was quite impressive in that it lays the basis for taking the market mechanism completely out of the National Health Service and restoring community health councils, and also it makes the provision that the private sector would only be used when it was to the detriment of patients not to do so. In other words, if there wasn't sufficient capacity in the National Health Service to do. Now, I think I'd like to hear the panel's views on this bill because it seems of vital importance. Following on from that, and following on from what David said about the need to return sectors that have already been privatised to the public sector, the Transatlantic Trade and Investment Partnership would preclude this happening. Now, I know we've had a commitment from Andy Burnham to exempt the National Health Service from it, but it obviously needs to be extended beyond that because it would be a threat to any potential to return provision that had already been privatised. So, panel's views, please, on those 2 points.
I did stand for election in 1997, and I've got a horrible confession to make that I also stood for election in 1987. And every general election that I've stood at, this is the 5th, there's been a rallying cry, 20 days to save the NHS. This is a subject that has come up time and time again. And, I know that the NHS, as has been acknowledged, does have considerable problems, and they do need to be addressed. It's just distressing to me that this is such a party political issue, because actually there is great unity about the NHS. Nobody wants to destroy the NHS. Let's go through the questions in reverse order. I don't think TTIP is any threat to the NHS. But actually, like everybody else here, I don't know whether it is because I haven't read it. It hasn't been published or agreed. And I ask why people want to kill this off before it's had a go. as a Liberal and a Liberal Democrat, I'm in favour of free trade, so if it's going to work, then I would support it. But I haven't seen it yet, so I can't really say no. I also did read, and you can read, the bill that the gentleman referred to, the NHS reinstatement bill, and it's a very interesting and comprehensive piece of work, and I applaud it. I think the chances of any government adopting it are nil. On the reforms and the Health and Social Care Act, yes, this was difficult in a coalition government. If you remember, we called for a pause for the implementation of the reforms, and I am informed that certain changes were made on the instigation of the Liberal Democrats, and we therefore voted for the bill. I also noticed that a Health Select Committee report into the effects of the bill was blocked by the Labour members of that Health Select Committee, and that was on the 11th of March of this year. And that report had concluded that there had been no sweeping privatisation, nor that there had been an extension of charges or top-ups. What's the number?
70% of all contracts issued last year have gone to the private sector.
What contract? Well, yeah, a nice independent website. The report also said there is less red tape and a general trend of declining administration costs in the NHS. In fact, they found expenditure on administration as a percentage of total spend has fallen from 5.1% to 2.7%. Now, this report has not been published, just like the TTIP, so to a certain extent we're relying on rumours about rumours. On the first question, can I absolutely agree with the lady and say about mental health expenditure, and Liberal Democrats have taken this particularly as a very serious issue which they want to adopt, and they have promised, I have avoided the word pledged, they have promised to increase spending on mental health services by £500 million a year from 2015 onwards if returned to government. Thanks.
First of all, yes, I want to reverse any privatisation. I think the best news we've had recently is that Sodexo have given up their contract, and we're getting the cleaners and security staff back in house. And I think one of the things that we want to make sure goes alongside that is they get their terms and conditions back under NHS agreements as well. The NHS reinstatement bill, I'm not sure where Paul got his information from, but the Labour Party are actually supporting that, apart from one clause, which actually I have to say NHS staff have pleaded with me to support, because there's one clause in that reinstatement bill that is about putting the NHS back the way it was before, and NHS staff have pleaded with me, no more reorganisation of the NHS, and Labour Party have committed to no further reorganisation. So, everything else in that NHS reinstatement bill, I think you'll find all Labour candidates are supporting. So I'm hoping that's good news. TTIP is an absolute threat to the NHS, and we must oppose it at all costs. I mean, where Paul is right is the deal hasn't been done yet, but we can't wait until the deal is done, because that's going to be too late. Of course, we want to look at trade agreements. We should have trade agreements debated in Parliament, but I think it's fairly clear that what's on the table at the moment is not acceptable. Personally, I'm wholly opposed to TTIP completely. I think the risks outweigh the benefits. But the NHS has got, as one of the largest organisations in Europe, clearly has huge procurement contracts. It's going to be very appealing to the United States to get involved in those procurement contracts. But what is very clear is that the procurement processes in the United States take place at state level, most of it, not at federal level. So that means our services would be opened up to that free market with the United States, but their services wouldn't be opened up to us. So that's one good reason. Another good reason is that it would also open us up to huge amounts of litigation if we didn't let them have access to our NHS NHS procurement. So, you know, my position and that of the Labour Party is there's absolutely no way we're going to agree to TTIP and unless the NHS is exempt from it. And there are so many conditions that we are placed on it as a political party that at the moment we would be opposed to going in and supporting that. On Valerie's point about mental health services, so yes, I mean, I think it's a sign that the Labour Party has listened, because I actually was campaigning with the Women's Trust, where we did the research into women's mental health and found that lots of women were going for years and years without having their prescriptions looked at again, and they weren't being offered any alternatives. And the women in Brighton I've met, and the women I've met throughout the UK, have said that they feel hampered in being able to go back to work or carry on with their daily lives because they can't cope with the mental health problems that they've got, and they're just not getting the right treatment. So it's bad for them, but it's also bad for our society that we've got people who are unable to play a full role in society because of their mental health problems. And I have to applaud Mind and the other charities that have just run some amazing campaigns over the last year or so that I've been absolutely pleased to support. But what they've done is they've raised the profile of mental health problems, but they've also helped to reduce the stigma, and I think it's great that more and more people are talking about it now. The other thing that we've pledged to do is to do with children's mental health, and that is to train teachers in spotting the signs of children experiencing mental health problems so we can get help for them at an early stage. So I'm really proud that we'll bring that in. I think locally, you know, we've got a serious problem. I did comment in the press a couple of months ago when Millview was full up, there was nowhere to take patients at risk, and we had a patient travelling something like 250 miles to get a place in an appropriate setting in hospital. That can't be acceptable. It's not right for them, and it's not right for their family not to be able to go and see them, because that undermines their care too. And we've still in Brighton, actually, we're one of the last remaining cities that still think it's okay to transport people with mental health problems in the back of a police van and put them in custody. And that cannot be acceptable, and that's something that we've got to work hard to change at a local level too. Thank you.
Mental illness is 25% of all illnesses, but only gets 13% of the budget, and that's got to change. And the Green Party has a commitment in its manifesto, which is coming out very shortly, which says that there must be a radical increase to the amount of money going to mental health. As someone who has seen my own mother suffer from Alzheimer's, I'm particularly interested in that whole area. And I've recently been involved with the Alzheimer's Society and becoming an Alzheimer's champion, and discussing with them about how to do that with the local bus companies and with other organisations in the city to ensure that organisations are friendly to patients with dementia and understand the issues. So I think that's a very important point. The second thing is just on TTIP. TTIP is probably the single biggest threat to public services that we face over the next number of years, and Paul is really mistaken to take this as being as saying that he thinks he'll just assume that it's okay because it's free trade and he'll see how it works out. If it does work out, we won't have any control over our public services, which is why I'm speaking next week at the TTIP meeting being organised by 38 Degrees down at St Mary's Church just down the road, because I think it's an absolutely horrendous threat and we all have to be fully behind the campaign to oppose it. The third thing, just in terms of the question from Tusk, yeah, I think that the privatisation of the NHS does have to be reversed. And Caroline Lucas's NHS reinstatement bill was obviously drawn up by the Green Party. It does have cross-party support, and it's something which we think is incredibly important. I must say I've never seen any Labour Party statement nationally at all anywhere saying it supports the NHS reinstatement bill. In fact, Labour has been supporting an alternative bill, the EFFORD bill, which is known in NHS staff quarters as that effing bill, because it still retains the Secretary of State not having the duty to provide a national health service, and it still retains the purchaser-provider split at the heart of it and the commissioning process. Labour has been supporting that bill against the NHS reinstatement bill. And Nancy said, and I have to say this, Nancy said, look, you know, I'm totally opposed to any privatisation in the NHS, and I believe her. I believe that is what she thinks. Unfortunately, it's not the view of the Labour leadership. Unfortunately, it's not the view of Ed Miliband or Andy Burnham, and it's not the view of Peter Kyle. I was on an NHS hustings 2 days ago, which, if you don't believe me, listen to it on BBC Radio Sussex, where when I said exactly the same thing as Nancy, he polemicised against me and said that it was outrageously ideological that I was opposing privatisation. I think by ideological he meant that I had principles, unlike him. And unfortunately, Nancy's party doesn't agree with Nancy. And that's the problem. And that's why I think it's not good enough to just say that an individual supports something. Actually, the party has to too. And the Labour Party does not support a number of these things. So it's sad. I wish it wasn't the case, but it is. So against TTIP, for more money for mental health, yes indeed, and for a consistent opposition to all forms of privatisation from the whole of any party that you support at this election. Don't just go for individuals, vote for a party that opposes any form of privatisation.
A couple of things that Paul said, really, about the report which hasn't been published. That was because it's not been agreed, but there has been a lot of reports based on the NHS bill which have been published. The most notable one was from the King's Fund, which was released about 3 months ago. King's Fund originally supported the NHS bill, but they actually showed, and their conclusion was, it has caused lots of disorganisation, increased management costs, and people don't actually understand what's happening with that reorganisation. Also, you talk about only 6.2% of the NHS is privatised, but since the new NHS bill has come in, this is not from a not for sale, this is a proper NHS Support Federation independent survey which has showed that 50%, not 70%, but 50% of new contracts have been sold to the private sector, have been taken by the private sector. Well, the difference in the values is, one is the number of contracts, the other one is the amount of money. So when you say the NHS bill hasn't led to privatisation, it has. And the reason it's only 50% is because people like the NHS support teams have stopped privatisation happening. Look at what happened at Worthing. They were going to privatise orthopaedic services. That would have meant that all the orthopaedic surgeons would have stopped working in Worthing Hospital, and so you wouldn't have been able to go to Worthing A&E with a broken hip. That would have put the whole A&E department at risk and then impacted on the Sussex County. If you have a reorganisation based on profits, you totally disorganise the NHS. Reorganisations have to be based on patient preference and what's good for patients, not on profits. And the one thing which hasn't been released is the risk register, which was written 5 years ago before the NHS bill. So if we're talking about unpublished bills or unpublished reports, let's talk about the risk register, which actually the Liberal Democrats stopped being published because there was a vote to publish it and they voted against it. And that would have shown you, and the leaked things have shown you, that they knew the impact of this NHS privatisation bill. They knew that it would affect, that instead of concentrating on things like elderly care and how to reorganise the NHS, it was worried about privatising it, and it's taking the emphasis on improving the NHS away. And we did not release that risk register because then people wouldn't have voted for it. So let's talk about that then. And then final, just on David's point, I agree with much of what you said, but the fact is we live in a first-past-the-post constituency election, and you've got a choice in wherever you live. The risk to me is Simon Kirby coming back to power because he would vote for the privatisation of the NHS. He would support the NHS support bill. It is not a competition in this constituency between Greens, the TU, the Socialist Party, and the Conservatives and Labour. It is a straight fight between Labour and Conservatives. So, your vote should really depend on where you live. And so you've got to think about where your vote goes.
I wanted to comment on the Green, on Davy Jones saying, what did Labour do last time? Labour did a lot of things, and they seem rather scared of actually saying what we did. One of the things we did was to stop smoking in public places, and that has had a huge impact on health. And numbers, actually, smoking has gone down. Another thing we did was give pensioners, give people over a certain age, free bus travel. That has a huge impact on health and the environment. And yet that seems to get left behind. And the Conservatives are saying that they're going to hold on to that. And I really do feel that you're so prejudiced, the Green Party, against what Labour has done. And it really is a straight fight in this constituency. Make no mistake, Nancy has to win.
Yeah, I was one of the group who campaigned against Bupa in Worthing, and we sat and we collected thousands and thousands of petitions. And what we found talking to people was that 99 out of 100 people in Worthing Hospital that came and talked to us did not want this privatisation or any other form of privatisation of the NHS. And the Liberal Democrat candidates' failure to understand this is exactly why his party are going to be deservedly wiped out in the coming election.
Hi, my name's Michelle. I work at the Children's Hospital in the operating theatres. I'm a nurse. I've been a nurse in the NHS for 30 years. I really, really believe in it. I've seen lots of changes over those 30 years, different governments coming in and out, and actually at the moment it is just the worst it's ever been. Yes, I'm at the Children's Hospital and I understand it's a PFI and all that was attached to that at the time. It is, however, an amazing building and I think we do amazing work there. My question and concerns is, though, that half the hospital is empty. There's no children in those empty beds because we don't have the staff for those beds. So surely we could be paying back the PFI better if we had more staff to open those beds and have the hospital really up and running. I work in operating theatres where we have to do an on-call system to cover emergencies out of hours. So that is after 6 p.m. on a weeknight and weekends. I was just on call for 72 hours over the bank holiday weekend, and I worked 35 hours of those 72. That is on top of my normal working week. Last week, I worked 72 hours altogether. I'm not complaining about that, you know, it's my job and I get paid about it. But what I am saying is that those on-call things that were put in place was probably 20, 30 years ago when we were only doing children in Brighton and Hove. We now cover as far as Hastings to the east, Worthing to the west and Crawley to the north. We also operate on children from Trevor Mann Baby Unit, who I know are really, really do a huge catchment area as well. So all in all, our work is so much larger. Also, on top of all of this, we can't recruit to our unit because we are specialists. I think Brighton, I read somewhere, is the third most expensive place to work, to live in the country. We don't pay our staff enough to recruit quality staff to come to Brighton. It's too expensive, so people aren't moving here. And my final point is, when they built the hospital, they built it with a PICU here. However, because of senior staffing levels at consultant level to run a paediatric intensive care, for who didn't know that, that part of the hospital isn't open, so the best we can do is run an high dependency unit at the Children's Hospital. And so currently we have very sick children come to our hospital. We have to treat and transfer them to the Evelina or Great Ormond Street, somewhere like that. So why aren't we looking at the Children's Hospital being, I mean, it's a major centre for this part of the country now. And with the trauma centre that's just going to be up and running soon, we were told that it's just for adults only and nothing was needed for the children. However, when there is a major trauma, as there has been recently, the children have automatically been brought to the county A&E department, and then we're having to get by, basically.
Just to say, I don't doubt that Labour did some good things when it was in power, but what it did also do was to extend and deepen the market mechanisms inside the NHS. That's a fact. It's not an opinion. And that has paved the way for the Tories to do some of the things that they're now doing. It's a terrible shame, but you have to face up to the fact. And Labour does still have lots of candidates, including one here in this city, who is clearly and openly pro-privatisation within the NHS, and that is a real problem. Second thing, on pay, I totally agree with the people who've raised the issue of pay of staff. It is a scandal how low pay is for nurses. My sister was a nurse for 40 years. I worked out the other day that in those 40 years, she earned the same amount of money as Wayne Rooney, the footballer, earns in a month. And that tells you everything you need to know about the priorities of our society. And there was an independent pay review body which recommended a pay rise for nurses, and this coalition government turned it down. I know, I was on every picket line outside the Royal Sussex, just up the road, to support the nurses. And lastly, PFI. PFI sucks money out of the NHS. One of the reasons why we don't have enough nurses, don't have enough staff in the NHS, is because PFI sucks all the money out. The amount of money which you repay on this appalling 8-hour purchase deal is astronomical. For every sort of £1 million that you put into it, you end up paying about £10 million back in interest on PFI. That's why it's so shocking, that's why it's so awful, and that's why it's so terrible that 100 out of 135 hospitals built under Labour were built under PFI, because they're all now saddled with those debts, and that's the problem. Just lastly on staffing, just to say is that, one of the things that came up in a big way on the NHS hustings 2 evenings ago on BBC Radio Sussex was the issue about agency staff. People were saying, well, we've got all these agency staff. Well, why do we need any agency staff? We should pay our nurses properly, pay our NHS staff properly, and have them on full-time contracts, not wasting billions of pounds on agencies.
It's moving to listen to our contribution over here, and there is no question that the NHS is a very difficult operation to run, that it's very expensive, and that it's going to go through a lot of changes over the next 10 years, whether we like it or not. It's my contention that in certain areas, the private sector should be involved, can be involved, something that Gordon Brown... Well, because I think the private sector does do some things better than the public sector. One example would be, I suppose, the drugs industry. Another example would be GPs. The vast majority of GPs are self-employed. I think it's just misuse of language to call it privatisation, but I can see it. I would like to make the point, though, that we have an open democratic system, and debates and achievements like was achieved at Worthing are possible under our system, and I would be horrified if that was no longer the case. For example, on the TTIP, that will be voted on in the European Parliament and the British Parliament, and that's the time when I would make my mind up about it. One thing, Rob mentioned a report, a risk... Risk register. Now, I'm really interested in that. I know nothing about it, but I'd like to hear about it.
So basically they did a risk register to see what the impact of the NHS bill was going to happen, and the Liberal Democrats voted to not have it released. And that
in Parliament?
In Parliament, okay. And so nobody knew the impact of the NHS bill, and if they had, they'd have seen that the emphasis would have stopped being about how to reorganise care, which was needed, such with the elderly population, and it was the emphasis put onto private or introducing the market sector and so taking the eye off the ball. So that was a disgrace that wasn't released because no one knew.
Well, I'll take that home with me, and I'd like to talk to you about it again because I don't really know much about that. Yeah, I know I should do. I should know everything about everything, and I don't. Sorry.
Be fair. He's debating. Don't be. He's debating.
Yes. Thank you.
Okay, I just wanted to correct something that was said. First of all, as we know from our local council that is Green-led, people in political parties don't always agree with one another, and people are independently minded, and people have different views. We are not a homogenous group. What can change this time, though, is getting lots of good left-wing socialist Labour MPs into Parliament that can put forward the views that are held in this room. That's what's important. And the reality is, it is a two-horse race, as that lady pointed out, in this constituency. We need to get rid of a Tory MP here in order to form a Labour government. It's the 25th most marginal seat. We can't forget that. We may not like the political system that's first past the post that we've got, but that's what we're stuck with for now. The second thing I'd like to correct, and I'm going to read it actually, because this is in Labour's 10-year plan, so it's published. Labour confirms that it will bring forward a bill to repeal the Health and Social Care Act in the first Queen's speech of the next Parliament, which will restore the Secretary of State's duty to provide services. Other things that we did that may have been forgotten about, we got breastfeeding rates up. which is going to help children over the whole of their lives. We brought down A&E waiting times, we brought in the 2-week cancer wait. That can be the difference between surviving and not surviving for many people, and we brought 18-week a guarantee of an operation within 18 weeks instead of 18 months that I mentioned earlier. So they're important. Let's not forget everything that was done. It is okay to put your faith in the Labour Party to save the NHS. We have got a lot of people in the Labour Party who want to protect the NHS, who want to save it, that don't want to see any privatisation. We are going to restore the powers to the Secretary of State, as I've said, and we are going to make sure that the NHS stays in the public sector. And Andy Burnham has given his guarantee on that. The lady, I'm sorry, I didn't catch your name, the theatre nurse. Michelle, and I'm not sure if we met outside the hospital, because I came down on one of the picket lines when all the staff were out, and I talked to quite a lot of children's theatre staff that day, and I was horrified by some of the stories I heard about the shifts and the hours that you do, and that concerns me hugely. And I'm very much opposed to the fact that the hospital is now going over to Spain to recruit nurses instead of paying the nurses we've already got more money. And I was very vocal on the issue of the bank staff when their pay got cut from £11 to £7 an hour. That was an absolute outrage. And we've got to do something about pay for hospital staff. We want to hang on to them. In my view, it is a false economy not to pay staff that we train through the tax system sufficient money to live on, because then they just leave, and then we have to pay more money to agency staff to cover those vacancies. We spend a lot of money training our NHS staff, and they're dedicated. They throw themselves into their work, and we should support them, and we should pay them decent money, and they should have good terms and conditions. And I'll make a promise to you now that if I get elected, I'd really love to come and talk to you and the other children's theatre staff about what needs to be done, and I will pass that straight on to the Secretary of State for Health, that we have got people doing ridiculous number of hours, that we're not paying them enough money, but also the issues you raised around intensive care, that worries me. We've got the facilities there and we're not using them. Clearly that's wrong, so I will make that one of my first priorities. Thank you.
TTIP is being negotiated behind closed doors in government and also in the EC. It has nothing to do with the general public, which it should be the general public who make the information and the decisions on it. It is about private corporate business, and it's basically about private companies taking on governments so they can sue them for their potential loss of earnings because stuff won't be privatised. That is what TTIP's about. That's why it should be slammed down flat, and everybody should have a say in it, not the people behind closed doors. A great thing that is always missed about the NHS, very, very quickly, is the fact it has a land bank. A land bank which is worth millions. Now, I give the examples of Southlands Hospital. Southlands Hospitals was joined up with Worthing to become a foundation trust. What did they do with Southlands? They moved most of the facilities over to Worthing. What have they done with Southlands? 3/4 of it is now housing. Private housing, making lots of money for the private sector, and also denying the people who could have had a brand new hospital there, the people who actually own that particular buildings and that site. That is what privatisation is about. I will also give you another example very quickly about talking about you becoming about mental health. I know this because when I worked at Brighton General for a number of years. We've got blocks up there that are all boarded up. Yes, they're old buildings. But we also had the old nurses' home, which ties into about the fact you were talking about cost. That nursing home that was up there was demolished and is now quality flats. This is what not should be happening. If we've got buildings in the NHS, they should be refurbished, either used for nurses, used for mental health. These are the things we should be doing with the money, not again putting it into the private sector.
My name's John. I'm sure people are aware the problems caused by the closure of Eton Place surgery and the fact that thousands of people are still without a doctor, which has resulted in many having to use an already overstretched A&E service. Myself and my wife were lucky enough to find one, though it is much further away and involves using public transport. We moved quickly as we did not believe in Simon Kirby's assurances in his newsletter that we need not to, and for the time being should remain with Eaton Place. And it was also reported that doctors' surgeries in the area are being offered £25 for each patient they take on, yet despite this, thousands still remain without a doctor. It is also clear from the reading of an article from Dr. Mockett, one of the partners, that the coalition's handling of GPs is a contributing factor to the two doctors' decision to retire early, and the morale has gone down significantly amongst GPs. But what is really of concern is that the National Health Service had the chance to buy Eaton Place 7 or 8 months before its closure. The offer was on the table from the start of the sale. So my questions are, why was this offer not accepted, or at least made public knowledge, so an alternative plan for another surgery could be put in place, instead of the shambles we are witnessing around its closure? As the decision was taken behind closed doors, was this yet another sneaky backdoor way to cut services? At a time when doctors are leaving in their droves due to the disastrous so-called reorganisation of the NHS, how many more surgeries will be up for closure? How many trusts will go bankrupt due to PFI? How long must patients suffer? And it's so important that this bill is reversed, and it has to be reversed in its entirety. And not just what's been privatised in the private sector, but also the voluntary sector and the community sector.
My name's Kieran. I'm a medical student here at the Brighton Sussex Medical School. Just firstly, I'd like to say thank you for turning up to our Liberal Democrat friend. I think it's quite important to listen and acknowledge to both sides of the story. I think everyone should remember that. My question is actually to the Labour Party. Given that the Labour Party were the only government in memory that actually privatised a hospital, being Hitchinbrook in Cambridgeshire, what can they do to make sure it doesn't happen again?
So my question is more for Rob, not the politicians, because I don't believe that you'll have much effect. But I'm from Brighton's Health and Social Care Network, and I work and study in the NHS. A key issue that is being raised is about the access to NHS services and about it being free at the point of need. Some of the most vulnerable in our society are being denied access and charged huge sums of money they can't afford, sometimes even before they've used any services. This is about the Immigration Act and is furthering charges and thus denying care to those in need. For those that claim this is because of health tourism and that this is a drain on the NHS, this only accounts for 0.1% of the NHS budget. Aside from the economic point, this Immigration Act is racist, and it's asking for health workers to become discriminatory and become extensions from the UK Border Agency and the Home Office. And the linking up of this service is increasing who and what can be charged as part of the sort of racist and privatising ideology that is being moved forward. And obviously, after sort of non-EU migrants, who's next? It will be the EU nationals, then UK residents, and then it'll only be the rich who will have access to good health service. So, Rob, at the last debate, and even just now, used the mnemonic CABC, so credit card, airway, etc. Well, we're starting to see VCABC, so visa, credit card, airway. And so what my question is really is, what are your opinions of the Immigration Act on the NHS and how that affects us working in a non-discriminatory practice? And are you willing to see what the BMA are going to do about it, considering at the student BMA conference that is this following Thursday, there's a motion to repeal the Immigration Act?
First of all, so John, on the Eaton Place surgery, I don't know if you're aware if you came to the public meeting we had, but we held a community public meeting about the Eaton Place surgery closing, and we also ran a petition, and we took a delegation to the council to talk to the Health and Wellbeing Board about that in an effort to save it. You're right about the £25. I actually had to put in a Freedom of Information request to get that information. They wouldn't tell told me over the phone when I asked them about this £25. They were offering £25 per patient to other GP surgeries to take people on, which I think is just a misuse of public money, in my view. Now, when we found out that surgery was closing, I think at the time NHS England actually denied that they'd been offered the chance to buy it. I think that's come out since, hasn't it? And we were told that the surgery premises were owned by the two doctors and that they actually wanted to sell it and they were going to move out. Then NHS England said that they didn't have the money to put another GP surgery there. I've done quite a lot of media interviews and I've lobbied them constantly about this because we think that is completely unacceptable to displace 5,500 patients, particularly at GP surgery so close to the hospital. And, you know, I have found NHS England to be far too blasé, really, about this whole situation. It was almost as if, well, they're closing down, so that's it, you just got to move. Now, when I went to the Health and Wellbeing Board, we still had around 3,500 patients still trying to find a place. And they were phoning other doctors' surgeries who, in the end, had answer phones on saying to people, we can't take any more patients, we're full. The fact that we've now got people who are terminally ill, people who are disabled, people who are elderly, having to get 2 bus journeys or a bus journey and a walk, and let's face it, Brighton's not flat, is it? You know, you've got to go up and down those hills. To get from around here to where my doctor's is, which is over Albion Street, involves going up and down hill or quite a long walk around. I just think that's too much for a lot of people. It's just not, it's not on. And what I would like to see is to now maybe think about incorporating a GP surgery within the new hospital. I think we should try and get some more funding or work out a way of getting a GP surgery in the hospital. I don't know if Rob would agree with that, because we had a discussion about what the impact might be on A&E, and that Rob was going to end up with lots of people going there because it's easier and quicker to get there than it is to get a GP appointment, given that we've now got, before this happened, we had some people waiting a couple of weeks for an appointment. I'm not sure how long some people are waiting now, but even longer, I would suspect, and it's not on. And the thing that I was probably most horrified by, apart from NHS England being so blasé, and I'm sorry that Simon Kirby's not here to answer this in person, was that I spoke to NHS England when we found out about the new contract. So we had 2 doctors in another part of the city that were considering taking that over. They got off with the contract, but as anyone knows that's bought and sold premises, a lot can go wrong. And NHS England said, we don't want to press release this because it could go wrong, and we've told everyone to find a new GP surgery and then they'll come back. And the fact that he wrote a letter to everybody to claim success for political point-scoring reasons, to claim success for saving the surgery, instead of putting people first, is an absolute outrage, and it was totally irresponsible. And sure enough, what happened? It fell through, and I had people ringing up and emailing me saying, is the surgery, are you going to save it? Is it saved? Is it not saved? You know, it was total confusion caused by his letters, and he then wrote a 3rd letter saying, after all, it's not going to open. Yeah, and we've still got people. We've got people who've not got a surgery place. And the people that worry me the most are the ones that, as a result of this, are going to fall out of the system. And there were quite a lot of people with mental health problems at that at that GP surgery, one of whom I've kept in touch with. And he was saying how important it is to him to have one-to-one relationship with his doctor. It's quite upsetting to keep having to re-explain why you've got a mental health problem. We shouldn't be putting people through that. You know, that's completely wrong. Where we've got my main concern is obviously we haven't got enough GPs coming into enough medics coming into general practice in order to make up for those that are retiring. And we have committed to doing something about that. We've recognised that as an issue, and Labour has supported the Royal College of General Practitioners campaign to increase the number of GPs, and we've committed to getting another 8,000 GPs. But it's still on my list, if I get elected, to get another GP surgery in the East Brighton area for those patients. Kieran made a point. I'm afraid, I've got to be completely honest with you, I don't know about this hospital privatisation, so I can't comment on it, but I've made it very clear where I stand, that I would oppose any privatisation. I don't want to see hospitals privatised. I think that's completely wrong. I do not want a 2-tier health system. I want everyone to be treated equally, you know, whatever their background, wherever they come from. We're all human beings, and we deserve to have access to our first-class NHS.
Well, I can reveal that, like probably many people in this audience, I was a patient at the Eton Place surgery, and something like Nancy describes, I got a letter from Simon Kirby immediately saying that he had personally rescued the surgery, written on House of Commons letterheading, which I think is against the rules. The next day I got a letter from Nancy saying that she had rescued the surgery, but in fact nobody managed to rescue the surgery, and I'm sure it's a lot to do with money. I can say personally I had no difficulty in registering at the Pavilion surgery at the end of the road, but I can also add that I then phoned up for an appointment, and it was going to take, and it will take 3 weeks for me to have my first appointment at the surgery. So yeah, we need more GPs without doubt, and it'd be great if we can have our surgery back in this part of Kemptown. It's interesting that Nancy's allowed to repudiate Labour policy while I have to stick up for Conservative policy. That's not really fair. I do occasionally stick up for coalition policy, in fact mostly, but I don't have to stick up for Conservative policy. And on privatisation, and the particular privatisation of the Hitchingbroke Hospital in Cambridge, obviously it didn't go well, and they repudiated the contract and have walked away from it. So that is a very harsh and bad experience, which I hope we all learn from, because my theme this evening has always been, this is not some kind of secret stitch-up. This is an open and accessible NHS, and actually, with private sector involvement, is more open and more accessible. We know that both in the private and the public sector, things go wrong. The Immigration Act seems to me to be a terrible piece of legislation, and if elected, I will vote against it.
On Eton Place, I agree with John and largely pretty much with what Nancy said as well. But I think the underlying issue which we've got now in relation to GPs is that this is just the beginning. You know, this is going to happen more and more. That's the problem. And it's going to happen more and more because the morale of GPs is now so low. There's a recent survey which said that 73% of GPs felt they'd been set up to take the blame for the cuts in the NHS. And 60% of them are now considering retirement or leaving the health service altogether. These are huge numbers. And so that means that this type of problem is going to happen more and more, and it's happening because of the changes which have been introduced by successive governments over the last 20, 30 years, which is why we come back to the whole issue of needing to reverse the whole process of privatisation, which has happened over the last 20, 30 years. John also raised the question of the voluntary sector, and I do think there's a real issue now in relation to the voluntary sector and the NHS. We're finding more and more privatisations are now happening through large-scale charities, voluntary sector organisations, massive ones, coming in with private sector partners and bidding together for contracts. And this is increasingly a big problem. I think we have to see that in some instances, the third sector now, unfortunately, is acting as a Trojan horse for privatisation into the NHS. And I think it's an important point that John raised on that. I'm glad that Hinchinbrook was mentioned. I mean, this is an issue. There's a real problem. It's not just Hinchinbrook. Lots of these private sector providers have now failed. I mean, you look around the country at the Virgin Care options. Look at the other private sector providers around the country which are increasingly failing. Look at the people who are handing back hospitals, handing back their contracts because they can't cope, because they don't make enough money. Because unfortunately, Paul, the problem is with the private sector is it's based on profit. It's not based on public need. It's based on making a lot of money. And just finally, on the immigration point, I spent my whole adult political campaigning life active on the immigration issue. I feel very passionately about it. I think that the way that we treat immigrants and asylum seekers in this country is an absolute national disgrace. I remember campaigning in the 1970s around what I thought were then reactionary immigration laws, and it's got worse and worse and worse ever since. And some of the ways that we treat detainees now, up at Gatwick, for example, is an absolute nightmare how we treat people there. And so I'm fully with you on that. The whole idea of health tourism, again, this came up at the NHS hustings the other night for BBC Radio Sussex. This whole idea of health tourism is a complete sham. It's a red herring deliberately introduced into the discussion to take away the focus from the real problem in the NHS, which is the private sector. It's not a foreign tourist. We're a net exporter of healthcare. More people get free healthcare from the United Kingdom going to other countries than get it here when they come to our country. And in fact, the largest group of people who receive healthcare in this country are Irish. Should we start with the Irish not being able to have free healthcare in this country? I mean, it's just outrageous, this whole idea of health. So we don't have UKIP here tonight, but if they were here, that's what they would have been arguing for. And I totally agree with the question at the back. The immigration system at the moment is an absolute national disgrace. And the way that it's now also being introduced into the NHS is even worse.
So there was a question directed about the immigration bill. I agree, I think it is a smokescreen. And I don't speak for the BMA at all. I don't speak for the Trust. I'm only here as someone who's passionate about the NHS. And I think that when we're looking at immigration, we've got to look at the positive benefits of immigration. We don't have a British NHS staff. We got a United Nations health staff. The last trauma call I had, the patient was brought to me by an Aussie paramedic. There's a Filipino nurse on the trauma team with an Irish A&E doctor helped with a Dutch A&E doctor. There's an Indian anaesthetist and a Spanish intensive care doctor. We are United Nations of healthcare providers here, and we have to appreciate what other countries have given to the NHS. I also want to make a couple of points about the GPs. The GP system in the UK is the bedrock of the NHS. This is what makes the NHS so great. The GPs do far more good than any other type of doctor because they prevent patients coming to hospital. They do that preventative medicine, which you don't get in a non-NHS system. And we have to protect our GPs. You know, my wife's GP, and I know there's such demoralisation going on in GPs out there. And the offer of 8,000 new GPs is great, but let's just remember, it does take 5 years after medical school to train GPs. So the problem we've got now is we haven't trained them enough in 5 years' time. So the Labour offer of 8,000 new GPs may only take a benefit in 5 years' time. So we must make sure we can actually back up those offers. The other thing is, talking about the Labour privatisation, I don't speak for the Labour Party. There's a lot of things that the Labour Party did wrong, a lot which they did very well with the NHS, but things they did, I think, for unintended consequences in the past. But I genuinely think they've realised that. And there's some health secretaries like Alan Milburn who didn't realise that, but Andy Burnham, I think, really does realise that and realises privatisation didn't benefit things. And that realisation, he's admitted that they've made mistakes. But I don't believe that the Conservative Party have realised their mistakes, and they're pressing ahead full steam along this privatisation, commercialisation agenda. And yes, Labour were involved in that Hitchinbrook privatisation. It was a massive mistake, but they've realised and they've changed tact, and that I think we've got to appreciate.
My question is in regards to the financing of the new build. As we know, Simon Kirby has hard-working ways about him, and he's ensured that £480 million is going to be released for the new hospital. But what people don't know is actually only around about £40 million has actually been released, and that got released a number of years ago. This is actually for basically the groundbreaking and the foundation making. The money hasn't been released. The money won't be released until the trust actually meets due diligence. So my question is, and a hypothetical statement maybe in some circumstances, but if you're a successful MP and you become our MP, how would you ensure that the money will be released, that the new bill can go ahead?
And my question is, have you looked at everybody looks about America, privatization of America, but what about in France, Germany? They have a different system, but they still keep costs low, at the same as the NHS in Britain. And, you know, because we do have a big policy debate about the NHS. It's not a football game where people kick it about. It's a serious issue because people, they depend their lives on it. And I thought maybe, you know, as we move forward in the 21st century, do we look at different countries and how they do the different things and different policies in order that affects our lives? Have you, looked into that kind of stuff? That was my question.
It's generally accepted that when we spend £100 of our taxpayers' money in the NHS, it provides usually about £100 worth of healthcare. When we spend that £100 with contracted out services, we get about £70 worth of healthcare because the private contractor needs about 15% for profit for the shareholders, and our NHS also needs about 15% to monitor and control and check the performance of the contractor. Now, I've been to a number of meetings. I've heard senior politicians on the radio. I have, on the one hand, not heard one single mainstream politician from the three main parties even attempt to defend privatisation. They don't even seem to want to recognise it exists. I've been to meetings like this. Everyone, as far as I can tell, everyone in the room seems to understand the problems of privatisation. I've never heard a member of the public support privatisation. So my question to the panel is this. Can they please give us any idea of why it is we have senior politicians in power from the three main parties who seem incapable of hearing us, the electorate, the people who pay the taxes, and they seem completely incapable of understanding basic economics? It's what we need, it's what we want. Why are they not listening to us? Can anyone help with that, please?
Let me start with you. I mean, I've made it really clear I'm opposed to privatisation. I'm not sure what else I can say. I completely agree with you. I spent many years when I worked in a transport trade union campaigning for public ownership of the railways, which I still support, and I ran a big campaign to stop the privatisation and the breakup of the London Underground. For all the reasons you described, I got a report written by Alison Pollock, actually, who's normally more associated with health PFIs, and I worked with her to produce a report that showed exactly as you described, that you're better off reinvesting the money in a public service that is there for everybody, and as soon as you start trying to have to cream a bit off for the shareholders, then as far as I'm concerned, then that's money, public money that is not being used in the right way. Rodney, on your the different countries, different policies, yeah, absolutely. We should always, I can't see where you are now. We should always be looking out for examples of how we can work better. You know, like you, I'm absolutely terrified of any move towards an Americanized style healthcare system where people have to start paying. You know, even if that's for a GP appointment, that just really worries me, because I know what will happen. It will be the poorest and most vulnerable that miss out again, and the people at the top will still have access to their good quality care. But yeah, let's go and learn from best practice in other countries, as long as that means keeping the NHS in the public sector. Ian, financing the new build. Well, yeah, isn't it remarkable how many times it has been press released and how many leaflets we have seen of our Conservative MP? I think he might even be building the hospital himself, you know. But it's not started and we haven't seen the money. Where is it? Where is this money? Where's the hospital? I mean, the ball got rolling under the last Labour government. Actually, this is the first lot of business case that was being set up. And we had some, you know, very timely announcements just before what is called the short campaign in the general election, that this money was we're going to get this extra money. But as far as I'm aware, it hasn't had Treasury approval. So clearly, and I should stand up to say this, my first job, if I get elected, has got to be to go in and see Andy Burnham and Ed Balls and say, where's the money for our hospital? We need the hospital. And I don't know whether this is a technicality because the election was called or what is happening, but Ed Balls is actually coming into Brighton, I think, next week at some point. So I'll try and get 5 minutes with him privately to say, when do we get the money for our hospital if we get elected?
Yeah, I agree with Nancy about the money. And, you know, if I get elected, I'll go and see Natalie Bennett and Caroline Lucas and demand that they provide the money. In terms of learning from other countries, I'm all for doing that, but I mean, you know, a number of reports have already been done looking at other countries, and they've all come up that the NHS is the best. The area where I think the NHS is weak, is where I've always thought it was weak, even 20, 30, 40 years ago, is that I don't think there's enough democratic involvement in parts of the NHS. I would like to see a much greater strengthening of the role of local population, local communities in deciding some of the community priorities for public health, for example. I've been involved in the past with my sort of professional hat on of doing something called participatory budgeting over just down the road along the south coast in Southampton with an NHS trust there, to allowing local citizens there to make the choices about where public health money is spent, what the priorities should be. That's the sort of thing I would like to see more innovation of. Just finally, on this whole thing about profit margins, I mean, that Richard raised. I think the problem is that so many of our national politicians from the main political parties, frankly, are in awe of the private sector, and they are comfortable with the private sector. We all remember Peter Mandelson saying that he was extremely relaxed about people becoming filthy rich under Labour, while the rest of us were absolutely extremely disgusted by it. And, you know, we remember that, and of course there is a revolving door. There's a revolving door going on between the Labour Party politicians and Conservative politicians and the private sector. 3 former Labour health secretaries, Alan Milburn, Patricia Hewitt, Lord Darcy, all now are on the boards of private sector providers of healthcare. The same could be said of the Conservatives. And in fact, lots of Liberal Democrat peers as well. In fact, 225 parliamentarians from across the main parties have interest in private sector companies. They're in government, then they're into the private sector to run them and to get the profits out of it personally from it. We don't have any of those people in the Green Party. We would not do that. We would make absolutely sure that any people who tried to do that from our party, if they tried to do it, we'd kick them out.
We don't want a lesson in economics, but the fact is that socialism, in the form that Davy advocates it, or eco-socialism, has been tried in various countries around the world, and the problem in those countries is not too much immigration, but people trying to get out, you know. There's not the place to have an argument about the private sector, but I will hold up my hands to being in favour of the private sector, of a mixed economy. There are plenty of areas in which the state has to perform and other areas where the private sector does, well, you know, that is arguable. I certainly would be very worried if it was 50%. But
Thank you. Thank you.
well, I'm not sure the private sector has totally failed. As I say, people in socialist countries, on the whole, want to get out. Capitalism is quite popular amongst the people. The argument would apply to running Sainsbury's.
Paul, can you just answer
Would
the
food be
questions?
cheaper?
That's enough, thank you.
Yeah, it is enough, thanks. Yes, of course, there have been many studies of how other countries do it, and it's quite interesting when you go into other European countries where their own health services are also very popular, and sometimes very less popular with the population, as it has been true in this country. It's changed, as I said at the beginning, since the 1990s, when the NHS was not as popular as it is now. The money for the new hospital, that's a technical problem, but surely I can't believe that we're not going to get our new hospital.
Paul Chandler said that a couple of things. My mythometer, I don't know about anyone else's, my mythometer has been going haywire through this debate. It's interesting what some of the politicians have said. Paul said that more privatisation in the NHS will make things more transparent. But as anyone who knows about competition and all the confidentiality stuff that you have when you're a private sector company, you can use European law and laws all around the world that protects you from providing information to the public. So it's not at all transparent. Also, if there's any argument about private sector being more efficient and saving money and being better, we can't forget that in the NHS, because of what Labour did and the coalition government and introduced more and more privatisation, we actually spend billions of pounds, at the very minimum, probably about £10 billion each year, on funding these internal markets. That is money that could be spent on our healthcare. It could be put into finding a cure for cancer. Billions of pounds are wasted just in competitive tendering. But I also wanted to pick up on what Nancy said. She tried to convince us, quite disingenuously, I think. Well, I just want to basically correct some of the myths. I will come to a question. But about the reinstatement bill, Labour, she knew that Labour don't agree with that. And she didn't mention the EFFOD bill, which is about extending privatisation. It's not taking it back before the coalition government came to power. It's extending it from then onwards. And she said about the duty to provide a comprehensive NHS by the Secretary of State. What actually Labour want, and this is really important, it's a duty to secure provision, which is privatisation, in other words. If we went back to before the coalition government's bill, and went back to producing a comprehensive NHS, that would be a lot better. But we need to have the reinstatement bill, not the EFFOD bill. So my question is, because of all these myths and lies that have been perpetuated, and because all 3 main political parties agree with privatisation, can we trust any of them?
Arguing about privatisation, you say it works in Sainsbury's, and so why wouldn't it work in healthcare? Well, actually, it doesn't matter if you sell. It's good to sell more socks or more cheeseburgers, whatever, for that type of thing. But actually, in healthcare, doing more tonsillectomies or more operations isn't necessarily the right thing for patient care. Piecemeal healthcare does not work, because actually what's important in healthcare is preventative medicine and the safety net of the GPs, not doing piecemeal more operations and stuff. So that's why privatisation and piecemeal and doing things like Sainsbury's doesn't work in the health service. So just to sum up, I'm very, very proud to work in the NHS, but I'm also very scared, because if the current trajectory of what has been happening in the last 5 years continues in the next 5 years, the NHS will not be the way it is now. I'm very, very scared. And so, you know, I'm not speaking for a political party, but I'm going to vote in my constituency for the party which I believe has got the best chance of stopping a Conservative MP getting in, because that is what's important. I may agree with the Green candidate wholeheartedly, but you are not going to be speaking to Mrs Bennett and saying... Yeah, so you've got a choice, but I'm scared of the Conservative government coming back in and carrying on this privatisation agenda, and so that's where I stand.
Okay, first of all, can I say thank you again to Sussex Defend the NHS for organising tonight's meeting. I think it's really important that we've had a chance to have this debate, and thank you to everyone else for coming along as well. I've been really clear all the way through this that I oppose privatisation of the NHS, and I think that, and I also did read the statement that said we were going to restore the duty to the Secretary of State for Health. That's actually published, so you know that information is there. And I've been really, really clear that I did support the NHS reinstatement bill, and apart from that one clause that talked about reorganisation of the NHS, because I have made a promise to NHS staff I would not support any more reorganisation. So I hope that's really clear. Now, you know, it is an important choice. It is an important choice at this election. And, you know, we've had discussions about whether you can trust politicians, and I understand the cynicism around that. Of course I do. It's one of the reasons I'm standing myself. Because there are 650 votes in Parliament, minus the speakers, etc. That's the number of people that get to decide the kind of things that we are discussing today. So this, for you, for those people that are voters in Brighton, Kemptown, is about where you're going to place that cross on the ballot box and who you trust most to actually go and be your voice in Parliament. I've made it really clear I'm prepared to stand up for people. I'm not frightened to rebel. I am not frightened to go and see ministers and secretaries of state and say, this is what the people of Brighton, Kemptown and Peacehaven want. That would be my job if I was elected. My job would be to represent your interests. And I've made it so, I couldn't have made it any clearer where I stand on the NHS. I've got 30 odd years work experience, and much of that has been with healthcare charities like, as I say, Breakthrough Breast Cancer, Asthma UK, Diabetes UK. I've worked in, excuse me, you know, the anti-poverty sector to tackle fuel poverty and child poverty, all of which lead to health problems, as we know. So I've got that grounding, I've got the experience of working with patient groups, and I'm absolutely passionate about the NHS and making sure that we keep it in the public sector and that we don't end up with an Americanized style of healthcare where we have a two-tier system, where we have to pay, where our services are restricted. All of that is wrong in my view. So I'm hoping that you will support me to become your next MP so you get a socialist voice in Parliament that will stand up for the things you believe in. Thank you.
I think in many ways, you know, the debate on the NHS sums up, it's symbolic of all the choices we really face at this election. Do we want a two-tier world with one set of services for the rich and one for the rest of us? Do we want public services run in the interests of shareholders of multinational companies or of the public? Do we want a world where we close the door to the sick from other countries, even though we expect to get healthcare when we visit their countries? Do we want to end the revolving door syndrome between government ministers and advisors and private companies? Do we want to return the NHS to how it was under Blair and Brown, or do we want to return it to its founding principles? Do we want to stop the creeping privatisation of the NHS once and for all, or do we want to vote for parties that have a track record of supporting it? You know you can trust the Green Party to do what it promises. We will keep the NHS public. We will root out the profiteers and reverse the creeping privatisation of the NHS. The evidence of the last 30 years is clear. The NHS is not safe in the hands of the three mainstream parties. So vote for the NHS and vote Green.
Ladies and gentlemen, I want to echo Nancy and thank you very much for coming and say that I have learnt a hell of a lot this evening. And I'm proud to be in a country where we can have a debate like this. And as I said at the beginning, I feel a great deal of anguish about this because I think we're being exploited to a certain extent for political ends. We're being weaponized, I think was the expression that Ed Miliband used. Because the vast majority of the population support the NHS and believe it should be run for the benefit of all and free at the point of use. And I believe that too. So thank you for coming and thank you for listening.
I just want to say thank you everybody for coming on behalf of Sussex Defend the NHS. As you're leaving, please have a look at our roll of dishonour, and I hope very much that you've enjoyed the debate. Thank you very much.